The thing with Parkinson's, I read, is that if you take 7 milligrams a day,
Hmm.
you can start seeing your Parkinson's reverse in as little as 7 days.
Yeah. So the big one was falls reduced by 42%. So if you're having Parkinson's, like having those tremors, like you're more likely to fall. And if you fall and break a hip, like that's usually what kills a lot of people. And like every cell in our body for the most part has nicotinic receptors on it. And so you looked at, there's a doctor who's during COVID, he had a bunch of his patients that were smokers and they're on their protocol. So they're in the hotel or the hospital room. They couldn't leave. So put them on nicotine patches just to kind of help their cravings. And none of those people died from COVID.
Hmm.
And the rest of the people that were his patients, they had issues or they died. And so he was just like, well, that's weird. Like none of these people died from COVID. And it's because like nicotine blocks the receptor site for the COVID virus. It was like a big game changer when you kind of understand that. But then you also look at how it impacts things like Parkinson's and Alzheimer's. There's some research. If you go and do some research online, you won't find, it'll say like there's no benefit to this, like there's no help. But if you do like a deep dive on ChatGPT, for example, like you can do a deep dive research on it, and it'll spend like 15 minutes researching like everything. It'll pull up some beneficial research studies that have been done on nicotine.